In his push to overall health care reform, I should say, President Obama is having to twist a lot of arms up on Capitol Hill, and they don't all belong to Republicans. A group of conservative Democrats in the House, known as the Blue Dogs, continue to press for changes, and some are even threatening to oppose the current House bill unless they get their way. Tennessee Congressman Jim Cooper is a member of the Blue Dog Coalition, one of the House Democrats' leading voices on health care issues. He even teaches a class on health care policy at Vanderbilt University. Joins us from Capitol Hill. Congressman, thank you for the time. Appreciate it. And did the president last night in his news conference address some of your concerns last night?
The president did a good job last night. And remember, it's really not his plan yet. He's allowed Congress to take over the drafting of this legislation. And I hope that doesn't turn out to be a mistake, because it's really not about authorship. It's really about craftsmanship and putting forth a good bill so that all Americans trust the new and improved health care system.
You and other Blue Dog Democrats have had some concerns with the bill moving through the House of Representatives. Where are the tension points right now? Where do you still differ, even with the president?
Well, Blue Dogs are fiscally conservative Democrats, and we strongly believe the president's right when he says that health care reform has to be deficit neutral in the short run, and in the long run, bend the cost curves in the right direction. And so far, every congressional bill, except for one, has failed to meet that test. Now, there is one, the Healthy Americans Act, the Wyden-Bennett S.U. Emerson bill, that meets the test, but unfortunately committee chairmen are not allowing us to consider that one. That bill, by the way, is also bipartisan, which I think is essential in health care reform. But it's not just the Blue Dogs who are worried about legislation. There are two or three other groups that are strong and large. One is concerned about geographic disparities, because Medicare has not been very fair in the way it's paid people across the country. Another group that's very worried is small business advocates who are worried that a surtax or a tax on jobs could hurt us during a recession time like this. And there's another group of pro-lifers who are concerned about any sort of federal subsidy for abortion. So there are several different groups that are deeply worried about what's in the legislation. We're not against reform. We just want to make sure the legislation is better drafted.
Let me ask you about one of the things you just mentioned there, and that is the surtax on the wealthy. The president said last night, indicated for the first time, he was prepared to support a surtax on those earning $1 million or more. What do the Blue Dogs make of that? What do you make of that personally?
Well, that's an improvement over the current proposal, which would tax people over, I think, $280,000. But still, we could pay for this whole bill just with savings from the current health care system. But you're already seeing tensions. A lot of hospitals and doctors came out today worried about even a proposal that would allow an independent commission, sort of like MedPAC, to advise Congress on how to reform particular aspects of these programs. Because the fundamental equation in health care is this: if we're spending $2.4 trillion today on health care, that means that there are $2.4 trillion invested interests who don't want to give up a penny of that funding, no matter how much they might be wasting that money. We know that America...
It was Blue Dogs who pushed for that commission to play a bigger role in this health care legislation. Do you think ultimately that's going to be a part of the bill? Is that enough to get Blue Dogs like you on board?
Well, we agree strongly with the president that needs to be part of the bill. At least I do. I can't speak for all Blue Dogs on this, but I think that the president's right on this. But that's just one of the health savings measures that we need to be looking at. There are others that the Congressional Budget Office is requiring. But let me give you an example. Already in the drafted legislation, there's increased payments for doctors of $228 billion. And the independent commission is only scored as saving $2 billion. And yet already the doctors and hospitals are complaining about possibly saving that $2 billion. We've got to save a lot more money than that, because we at least have to offset the increased payments we're planning on paying the doctors. And that's just at a start. So they're in the earliest stages of this debate. We have a long, long way to go. It will take months, but I think we can get it done, as the president says, this year.
Well, let me ask you about that schedule, because the president's also pushing for the House and Senate to wrap up work on their bills by August. Is that now done? Is that toast?
It looks like it's going to be impossible to achieve. Senator Durbin said yesterday the Senate would not be able to meet that deadline. It's unlikely, without a House markup today or tomorrow, that the House will be able to meet the deadline. I'd be more than willing to sacrifice my August recess or vacation, whatever you want to call it, because I believe in getting health reform done. But Congress seldom wants to sacrifice the August recess.
Congressman, let me just ask you finally, are Democrats, conservative Democrats like the Blue Dogs, prepared to stand in the way of the signature achievement for this new president at this point in time?
Well, we believe we're helping the president achieve his goals, because oftentimes the main adversaries to the president's goals have been powerful committee chairmen in the House and the Senate are not quite on the president's agenda. We think we are on his agenda for a deficit-neutral bill and one that bends the cost curves in the right direction.
All right. Congressman Jim Cooper of Tennessee, appreciate it very much. Thanks for joining us.
Thank you.